Are we live, Kath?
Yeah.
Good afternoon, Barda, Panantha, everybody. Welcome to Scrutiny today, and we'll be looking at a number of items for health and social care. Before we get started, just like to welcome officers, and we have got Councillor Sian Cox as portfolio holder for adults. Welcome to Scrutiny. Do we have any apologies, please, Kath?
So we've received apologies from Sharon Fruin, but we've got Adam Greeno from Adult Social Care. I've received apologies from Councillor Jake Berriman as leader and portfolio holder for Future Generations, Sandra Davis.
I've also received apology from Councillor Ben Breeze.
Thank you very much. I'll note that. Steve Holcroft is just joining the meeting.
Oh, okay. Any declarations of interest? Has anybody got anybody that works in either services or is closely connected to anything that we're discussing today? Just having a search for hands. Can't see anything. Then next one is the disclosure of party whips. Anyone had a whip on this? No. And then minutes from the previous meetings. Myself and Gareth have had a look at these. Anyone got any comments or queries on these? Or if not, could we take them together, and could I have a proposer and a seconder who is in attendance at both? Let me have a quick look at so Gareth, you were at both. Was Gareth at both? Yeah, I think so. Chris. Oh, hang on, I can't see both at the same time. Are you able to see, Kath, which councillors were at both, or should we take them separately? Sorry, my screen has just gone blank now as well. Could I have a proposer for the first meeting?
Councillor Carl has his hand up.
Oh, hi, Carl.
Hi, Chair. It's just under declaration of interest. I've only served on this committee twice now, and my wife is a carer. My auntie's a social worker, and I have a number of other family relatives that are in the care industry. So,
Are they employed by Powys County Council, or are they in receipt of indirect financial things from?
yeah, my one relation, my auntie, she's a social worker, and she's employed directly with Powys County Council.
Okay, could we make that as a standing declaration of interest for Councillor Carl, please, Kath, rather than him having to make it every single time? Is that okay?
Yes, of course, Chair.
Okay. Sorry, going back to the minutes. So on the 16th of April, Gareth, you were there.
I'm happy to propose, Chair.
And Carol was there, and Alwyn, you were there as well. Alwyn, are you happy to second? Oh, is Alwyn?
Yeah, I'm happy to second, Chair.
Great, thank you.
Yeah.
And then on the other one, let's have a quick look. Sorry, jumping from one thing. I've got Chris, who was there, Little was there, Carl was there, Josie was there, Alwyn was there, Gareth was there.
Happy.
Happy. Thanks, Chris. Can I have a seconder as well, please?
I'm happy to second that as well, Amanda.
Thank you. Thanks both. Right. Oh, sorry, that was a little bit more jumping about than I thought was going to be needed. So the next item on the agenda is the annual complaints report. Steve, welcome to Scrutiny. I realise you've only just managed to get into Scrutiny.
Thank you.
Are you happy
Yes.
to take this now, or we had a quick discussion about switching the items round if you were having any technical difficulties? Are you happy to just jump straight into it?
I seem to be there now, Chair. So if you want to
Okay.
continue, if everybody can see my screen, that is.
Yep, I can
Yep.
see your screen. So, yes, thank you for coming to Scrutiny. This is an annual item that comes every year.
Yep.
We made some recommendations last year, which hopefully you've had a quick chance to review. I think, we've all read the report, so we don't want to go through, have the whole thing read out to us or go through it, page by page. But what it would be really good is for you to give us the sort of key themes and, the areas that you'd like to highlight to us as areas of concern or areas of, positivity.
Sure. May I continue, Chair?
Yep, absolutely.
okay.
Thank you.
Thank you. Good afternoon, everyone. In terms of a brief overview, we've seen increased demand pressure on our frontline teams, and that has severely impacted our service delivery. We should remember that to resolve complaints informally and at stage 1, and to a certain degree at stage 2, it requires frontline practitioners to be involved as well. And we get most of our information from them. So that has impacted our service delivery, as I say, in particular, the response times. There has been an overall increase in the number of complaints received and a significant increase in the number of contacts we have received as well. There's increasing volume and complexity of complaints. We still try to keep the focus on informal resolution where we can. It's far more cost effective. However, again, the pressures have been felt in that area as well. Just some of the key data we've been working with. A good proportion, just close on 70% of our complaints are resolved informally. 52% of stage 1 complaints are completed within the regulatory time period of 15 days. Last year it was 22 days, and now our actual is 24 days it's taking us. And I think that's just reflective, particularly of the pressure on frontline teams. 11% of our stage 2 complaints were completed within the regulatory time period. And much of this does come down to sometimes single complaints. There's one complaint in particular that took 111 working days to resolve. An unusual one, but that obviously has impacted on our response times. We're receipting all our contacts on average within 3.2 days. The target in the regulations is 2 days, so it's significantly above that, and we've got an action plan to work on that as we speak. Since 2020-21, I beg your pardon, we've had no cases investigated by the Public Service Ombudsman for Wales. That has continued thus far, and it's something we're relatively proud of in a way. It's showing the quality of our investigations when we do get to them. We've seen a significant increase in compliments for children's services, up to 168 compliments, and 81 compliments for adult services. Which is an increase of over 50% from last year, I understand. When it comes to the themes around complaints, and this has been a constant theme over many years, is complainants perceive poor communication from practitioners. And a particular item that has arose of late is what we're hearing in our complaint letters and on the phone and so on, is we're dealing with individuals who perhaps have a diagnosis themselves of ADHD or autism, or the person or the subject that they're complaining about has those concerns, and they believe that not enough, that practitioners do not take this on board enough and get to understand them better. So that has been something we've been concentrating on as well, and I'll come to that just in a few minutes. Again, professionalism, actions of practitioners if they don't agree with a particular course of action, and a failure or delay in carry out agreed actions. A lot of these are to do with funding in adult complaints, finding a care provider, respite times, and so on. Financial matters are an increasingly common complaints theme in adult services, whilst historically, and as you would expect, child protection matters are a common area of complaint in children's services. some of our learning from complaints. Due to the failure of a particular provider in terms of direct payments in 2023-24, we used a lot of that complaint material and in the development of a new practice of how we pay direct payments to clients. And that has been really significant. It's been well received by clients, and it seems to be working extremely well at the moment. Just coming back to the communication theme that I discussed a little bit earlier, we're currently developing with the practice development team things called insight breaks, and we're going to start those with children's practitioners. They're relatively short sessions dealing with topical items from complaints, and our first one is communicating and communication with people on the autism spectrum and or with ADHD, because we really believe that is coming across very strongly in complaints, and we want to do something about it. We also contribute to monthly briefings in conjunction with our communications colleagues. We're sharing complaint information and some of the learning from those, and we're also putting together an improvement plan on our response time. It's something actively being worked on at the moment, as those response times are not necessarily getting any better or any easier to deal with. In terms of those compliments, as I said earlier, adult services received 81 compliments over the period, a significant increase. I think from last year it was 33 compliments we had. Children's services received 168, and I've put a little asterisk there next to it, not to negate or take anything away from children's services, but they do have a lot of sort of in-house compliments that'll be from one professional perhaps to a younger or a less qualified worker, which it really helps in building the service that we want. We've seen a marked increase in the compliments received. Children's Services publish a fortnightly staff bulletin, which includes a section on compliments received, and compliments are also used by both services to highlight and promote good practice. Our priorities moving forward would be, we want to increase the use of AI for report writing and in the production of accessible documentation. And we're also we'd like to develop, it's in the very early stages of a chatbot. We developed a policy chatbot for practitioners so that what they can do when they're online, the chatbot will answer certain questions for them. And we are hoping that we could roll this out to customers so that they could engage with the chatbot to find out what their options are regarding their complaints or whatever it is they're unhappy about. We need to deliver a comprehensive complaint handling training. We've seen quite an overhaul of staff, so we really need to get people trained up to what we require from them in terms of complaint investigation. So we'll be doing that. And we also understand that Welsh Government will be providing some training on complaint handling as well, which we'll try and marry together. We've got, as I say, the improvement plan for our response times is with SMART objectives. And it's something we're currently working on, as I said earlier. And we want to enhance communication and accessibility for residents. This is something we hear about quite frequently in the various meetings, different ways of communicating with residents, videos on the internet and things like that. And I think that's just a snapshot of where we've been for this year. Thank you.
Thank you, Steve. I know we're going to have a number of questions, but I'll just ask a sort of overarching question as to something that we can notice in action. In that a few years ago, a few of us attended laming visits within the complaints teams. We came to, I think, the monthly sort of checkups where you go through.
Yes, it's a fortnightly.
Yeah.
It's
could we have those back on our agenda again so that we can we haven't done it for a couple of years.
Yes,
Could we do
definitely.
that again over the next year? I think, it wasn't something we needed to do every year, but it would be good to dip back in now, I think.
I think so. It would be interesting. Yeah.
Yep. Especially given, some of the concerns that you've raised in terms of the increases and the complexities.
Yeah.
And I'll go over to questions now. Councillor Gareth.
Yeah, thank you, Chair. Can I start with just a couple on one on table 1 and then on the first chart in section 4. On table 1, where you say the total emails received and average per working day, I don't understand the figures for 21, 22 and 22, 23 because 22, 23's got a lower number of emails, but an higher average per working day. So are we using a common number of days per year? Because I've done the calculation, it doesn't seem to be a common number of days.
Okay, I'll have to really look at that. Will I be able to come back to you with that as well? Would that be okay?
Yeah, but can that come back via the Kath
Yeah.
as committee clerk? You know,
Yeah.
to me, that's an error.
Yes.
It appears to be an error.
Yeah,
Therefore, to me,
it
that puts
does.
all the figures a question in my mind. Can I then go on?
Sorry, just to pause you, Gareth. What we'll do, Steve, is in our report, we'll have like areas
Yes.
that the committee noted. So rather than it being a
Sure.
recommendation, it can then be something that's responded to through that.
Absolutely, no
Yeah.
problem.
Carry on, Gareth.
Yeah, can I then go on to the first table on section 4? I note that the second and third target we've missed significantly. The one is
Yes.
missed by 18%, and the one is
Yes.
missed by 39%. You stated about the one stage 2 investigation that took a long time. If you exclude that, what would be the average time? And what action are the services taking to actually resolve the timing so that we make sure that we meet our targets? A 50% target is still not very high. No, I'd like to see that to be 90% plus. But
Sure.
what action are we taking?
From children's service, for example, what we're doing, because it often takes us let me just explain, under the regulations, when we acknowledge a complaint, we have to respond within those 2 days, and we have to respond with the name of the investigating officer. And sometimes this is where it breaks down, that we cannot communicate because we haven't got an answer on who the investigating officer is going to be. So that affects our times. So, sorry, can you just repeat the second part of your question again?
I
Sorry?
think it's what are you doing about that?
What are you doing about the
Yes,
failure to meet targets? Because I also noticed as part of of the next steps, there's no target set for those particular actions for next year.
Right.
Let's just Steve just answer one question at a time. So on the delays where you've not been able to identify an investigator, what are you doing to try and mitigate against that?
Okay, so what we did in children's services with the help of the head of service, they have a list of all available investigators, and it really is just that, a list. And if somebody's busy with a complaint, it moves to the next person on the list as well. And we're looking at a similar sort of process for adults as well.
Is that working then in children's?
It's significantly improved things over the last sort of 2 months, 2 or 3 months that it's been in place. Yes, it has.
Can I come in, Steve?
Yeah.
Yes,
Just to
thanks, Sharon.
assure Scrutiny Committee that's okay. And we recognised that we weren't actually hitting that target in a timely way in terms of picking up that complaint and then actually dealing with that. So we have created a mitigation to kind of assist with that, which is, as Steve said, we've got a rota in terms of all our practitioners who are eligible to undertake complaints. And then if there's a challenge with a particular individual not being able to have the capacity at that time, that I just make the decision, we move to the next available person on that list. So we've got a much more robust system around dealing and engaging with the complainant.
Okay, thank you.
Thank you,
and do you
Sharon.
have a time frame for bringing that system into place for adults then?
We're hoping by the end of this year. We are hoping to have it in place by autumn, and then measure results by around the end of December, end of January, around there.
So you're hoping to have it in place in the autumn?
In the autumn,
okay.
yeah.
Okay.
Yes.
Gareth's other question was that if you removed that one case which took a significant amount of time to investigate, did that completely skew the figures really? Is that something that you're able to give us separately, or do you have it to hand?
I don't have it to hand, but I will be able to give it to you separately. How it's how it affected our timescales. Yeah.
Thank you. And Gareth, what was your third point?
The last point was there doesn't appear to be any target set for those 4 actions. If you look at the end of the report of the next steps, there's nothing about saying what the targets are for 25, 26. One of the important thing about this is actually showing trends.
Yeah, it's the statutory timescales that we work to.
No, it's the timescale. But in the table there, you were saying that the target is 50%. And 70%. What are the targets for 25, 26? Are we leaving them at those 2 figures, or are they being updated? Because 50% is still not, that means that only after stage 2's investigation be investigated on time.
Yes, no.
Whereas I would think they should be at least 75%.
Yeah, well, we've put them at 70%. That's what we're toying with. As I said, the actual action plan has not been fully drawn up. We're still in the midst of it, so to speak.
But sorry, Steve, but how can that be the case when you're looking at an action plan for 25, 26 when tomorrow is the last day of period 4 of that year? The action plan should be in place before the start of the year, in my mind, or very little needed to be updated on it.
Yeah, there should be very little that needs updating. I can bring those to the committee.
Could we have a recommendation that rather than them come to the committee like next year, could we have an update on that just in writing with that action plan? I think that would be helpful.
Of course.
Otherwise,
yes, I can do that, Chair.
Otherwise, it's too far along the line. I think
Yes.
that's what I'd like to see.
Sure.
Okay, thanks, Gareth.
Sure.
Councillor Chloe.
Thank you, Chair, and thank you for the report and all the work that's gone into it. Obviously, it's a very long report with lots of information in it and a very challenging service. Just a couple of things I was thinking as I went through it. For me, when I look at this report, what I'm interested to know is what are people getting in touch with us about? What are the topics, and what are we doing about it as a local authority? And obviously that, to a certain extent, that is in there. You know, you've got the themes, everything broken down, but I think a summary at the beginning, just setting out really clearly, like, this is what we want to know about this. So what are people getting in touch about, and then what are we doing about it as a local authority would be really good, I think. And then I also think,
Sorry, Councillor, just to come back on that point, are you suggesting a sort of executive summary at the beginning of the report? Yes.
Yeah,
okay. All right.
I think that would be handy.
I will ensure that that's in the new format. Yeah.
And I think the other thing is, when looking at this, you know, it's titled a complaints report, but obviously it does include, as you mentioned, the compliments that we receive as well. And I wonder whether, instead of viewing it as complaint, this is feedback. This is our customers effectively are feeding back what's not working, and so whether actually we should be reviewing it as constructive chance for us to engage with people and do better effectively. And then my last point.
Sorry, Chloe, are you suggesting that it should be called something other than complaints, like complaints, comments, and feedback, or complaints, compliments?
Something like that. Yeah, I think that would be, if if other people thought it'd be useful. But just for me, complaints felt like it was making it feel negative before we even started. Whether feedback or something like that might be more useful. But yeah, I think actually that suggestion, complaints, feedback, and comments, something like that would be useful.
Yes.
Okay. Let's park that as a recommendation for us to consider when we just get to the end of this section, and then I'll just see whether other councillors agree with that, Chloe, and if so, then we can make that as a formal recommendation.
Yeah, no problem. That's fine. Thanks. And then the last one is just, I noticed obviously communication was a major issue. And when you looking through it, it looks like that's to do with capacity in a lot of cases. And it mentions things about staff sickness and leave. I know just wondered whether there's much well-being around the staff to ensure that, whether it's stress and overwork that's causing this, whether there's something we can do internally to make it a better work environment for our staff to try and reduce their leave requirements, or whether that's already on the cards, or whether it's the leave and absence is in line with completely normal levels, and it just happens to be that because the service is under such pressure, it comes up a lot.
Just before I bring in Steve and I know Adam and Sharon have both got their hands up on
Thank
that.
you.
Just on that communications point, I think there's a quote in there where it says a lot of the communications complaints were, and then it says around the social worker. So it would be quite useful to know, what does that mean? Is that in terms of it delay in the social worker responding, miscommunication by the social worker, the tone of the social worker that it's using, or is there a theme within that? So yeah, Steve, if you're able to pick up that within Chloe's comment, and then I'm going to bring in Adam and Sharon as well.
Yeah, just one comment really from adult services. One of the themes we've picked up is around charging. I know a lot of people have been very unhappy about receiving charges that they weren't expecting, really. So what we tried to do is be really clear up front now around the charges for services, and we've developed information leaflet with finance that we give people as well. So we're trying to reduce that way.
Yes.
Steve or Sharon?
Yeah, can I just come in, if that's okay, Chair, on just about the points the councillor's made around communication. So in terms of children's services, obviously, as Steve's outlined, it's often the matters that we're dealing with are highly personal, highly sensitive, and we do get a lot of kind of comments back around maybe that sort of level of communication, which actually could be about just maybe not responding as quickly as the individual would like. Maybe that telephone call hasn't just been updated. Maybe a piece of information hasn't been provided. So it is a whole range of things in terms of that communication. What we have tried to do is look at trying to improve communication as a system in terms of the team. So we have introduced roles such as coordinator roles, which actually then support social workers to actually maybe follow up on feedback, follow up on communication, which actually has helped overall. And you will see that then referenced evidence in the compliments. So we always expect to get a level of complaints, and with the themes we kind of look at what those themes are and then break that down into cycles of learning, because there's always things to learn and there's always things that we can improve on. So whatever those themes are, we then look at that strategically and then embed that back into practice operationally. So we'll do particular training, feedback session on learning from complaints, because you can learn just as much from when something goes really well to just as much as something when it doesn't go quite so well. So we've got then created that kind of cycle of learning and loop within that. And just to come back on capacity, social workers will always say that they don't have enough time to do X, Y, and Z, and we have to carefully always look at what does that actually mean. In terms of percentage of sickness rates for children's services, we have a very, very low percentage of sickness rates, and that's evidenced in our monthly performance reports, which you all have sight of. And actually, we've kind of embed a lot of time and energy into well-being for our staff over recent years. So we've got a whole well-being programme that sits and supports our staff to be the best practitioners they can be. I particularly like the comment about not it just being about complaints, because obviously it is about feedback, comments, and that whole cycle of learning. So I completely would kind of suggest and advocate for maybe that approach as a committee to consider. But yeah, just to add a couple of comments back to what some of the questions and Steve's feedback as well.
Thank you. Steve, did you want to come back in on those points?
I just see Councillor. Sorry.
They're probably new questions.
Oh,
so it's just if you wanted
beg
to
your
follow
pardon.
up on those points that Chloe had raised.
Was there any? Sorry, I've been listening to Sharon now, and I've forgotten where we were.
So,
Chloe, did
sorry,
anything
Chloe,
you feel wasn't answered?
Well, I was just thinking, Sharon gave a really good feedback on sort
On
of
the
children's
well-being
services and the well-being plans there. Is that the same in adult services?
Yes, yeah, not exactly the same. A lot of the well-being initiatives are driven by human resources. So we have well-being Wednesdays and so on, but we are getting there as well in adult services as well.
Thank you.
Okay, thanks both. Councillor Chris.
Thank you, Steve. It's a really helpful report, and there's a lot of work in, as been mentioned. I do support Chloe's viewpoint that we should be making more of this, because it's not just complaints, it is about the feedback. And I think that's really important to do, because there are huge opportunities for lessons learned to improve.
Yeah.
But if I just turn to the report, if I may, and it may be
sorry, could I just say something, Councillor, about why it's called the complaints report? That's how it's referred to in the regulations. They must, you must produce a complaints report annually. Yeah. Anyway, sorry, I'm sorry about that.
But if you tie it up with complaints, compliments, and feedback,
yes,
it just gives you a different feel to it. Otherwise, when people read it, it seems negative, and particularly if you've had numbers, which when you put on the, I'm looking at table 1, emails received by the feedback team, and I'm going to, because of COVID, I think 2020, 21, 21, 22, 22, 23, I would say that we've got some anomalies there, and I would park those. So I'm then comparing 2019-20 to 2023-24, and there's some similarity there. Again, I question the average per day working on there. Is that just a number? I didn't understand what that meant.
That was the average number of emails per day, yes, that we have to deal with. Yeah.
So the growth of that, I think, looks back in expectation of what it was in 1920. Under 3.2 above it, it mentions then a gap in the administrational support team from, I'm assuming that's April to September. Did that have any detrimental effect on, you know, the processing of those emails that are coming in, particularly on decreased volume due to that? And I'm assuming that that funding was from grant funding, but that's an assumption, so I need to clarify. If it was, it raises questions to me around effective planning of succession planning. And I just want to get a bit more understanding around that, if that was the case. Because when you're dealing with complaint management, my background is I've dealt with a team dealing with the with complaints, compliments, and feedback. Sometimes you've got to get people up to speed, and that's not happen overnight. It takes a little bit of time to be able to build them up with the skill set. So I've got those issues there. You mentioned that there'd been a growth in ADHD complaints. And I just wonder if you're seeing a growth in that area, is there something that then requires a deeper dive into that area? And if so, would that be helpful to be done by this committee or through another committee? And do we have social workers geared up with neurodiversity practitioner type skills on the and that? And just one point of caution about using AI. I've recently utilized AI to help do something, and when I've read it, it's then took me more time to actually go through it, and I then think I would have been better off just writing it myself from the start. So just a point of caution there. And chat boxes, I've dealt with one of those trying to get through to a TV company to change something, and I ended up giving up the ghost after an hour and 40 minutes because it didn't work. So I'll just leave you with that one.
We would trial it, Councillor, before to see how, you know, if it's popular with clients. It wouldn't just be something we've imposed. The chatbot I was referring to, for example, for practitioners, has proved quite for adults practitioners has proven rather popular, in fact. Yeah.
Okay.
But it might be different with the customers. I acknowledge that, and we will bear that in mind.
On Chris's point to do with the deep dive that you're doing into the complaints relating to users that have ADHD, perhaps if you're having any meetings or follow up on that, that could be an area where we do a laming visit.
Certainly, yeah. I would be very open to that, yeah.
Because I come in on that point,
sure.
Steve and Chair, if that's okay. So I think some of the complications around neurodiversity, as the councillors mentioned, which obviously looks at ADHD in terms of that particular condition. We recognise that actually some of the waiting lists for young people that experience some of these challenges have been up to 2-3 years plus with Powys Teaching Health Board. So that has been noted as a risk in terms of our Start Well board and agenda. So that's when we look at, through a partnership space, all those kind of areas of things that are working well, but also those areas where things are not working well. So we're very aware that actually that has been a huge pressure for Powys Teaching Health Board and those families looking and waiting to receive a service. So this year, Powys Teaching Health Board have actually changed the way in which they're working. They've managed to reduce those waiting lists, but it still remains a key priority for myself, who co-chairs that Start Well board, to monitor and look at. So Chair, in answer to your question about a layman visit, that potentially is an avenue that you might want to explore through that Start Well board arena, in terms of a layman visit specifically to the work stream, that actually where this would sit and where you would see feedback from children and families, but operationally what is happening, how they're mitigating against that long waiting list, what are the plans for the future, etc. So it's just a suggestion, but that might actually be something that you might want to consider. But it's just so for assurance, I am cited on those particular challenges, particularly around neurodiversity.
Okay, can we take it as an action, please, for us as a committee, Kath, to look at laming visits generally and what we've got in the diary?
Can I just come back, Amanda, on that, if I may? So that is reassuring to understand that, but what I'm trying to also see is whether there are gaps within that service, and those complaints that do come in, or that feedback that does come in, does it highlight where there is a gap? And is that gap then with the local authority, or is that gap with the health board? And if it is, then the models that we're then developing, so within the health board, Better Together, where is that then being fed into? So are we sharing the lessons learned from our feedback with them, so they also learn through that process, and we improve the offer that we're currently giving going forward? So, and that on there, there was just one other note that I mentioned, was mentioned, and I just wanted to come back on. I think it was, it could have been the other Steve that mentioned charges for services, or it could have been Adam.
It was Adam.
Yes, I think
what are they for, is a question. And then have you made, because I'm not aware of, those charges and what you charge for those services to be given to counsellors? Because I do a monthly surgery, and if someone comes in and they're asking questions about that, we're given the same consistency of information across as yourselves, and I think that that would be helpful, so that we can at least then understand that on the, because I know in the past when we had changes to direct payment charges, there were a number of things on there, and it was quite useful to have an understanding of what had happened in this committee in that role. And I'll stop there, Chair.
Chair, I can ensure that councillors receive, or the committee at least receives copies of that document.
Yeah, that would be helpful because lots of people have other things like newsletters, etc., that they could append them to.
Sure.
I'm going to take Gareth's question as the last question because we've got quite a few other things on the agenda. Councillor Gareth.
Yeah, thank you, Chair. Just picking up on the point Chris made on table 1. I'm a bit of a data geek, but it needs to be complete and accurate. And if you look at 3.3, I'd like to have an explanation why there's a 31%, why we think there's a 31% reduction in emails received between 22-23 and 23-24. And then if we then go on to section 4.7, it says that there's data missing. So that immediately puts a question in my mind about the validity of this data. It says, it says a small number of complaints in quarter where the numbers of elements were not recorded. So that means we can't do that comparison between years and across periods.
Yeah, it's something we'll have to get quite strict on as we move forward, certainly as we move forward. I'm not a data specialist, so that's not my area. But I will ensure you have, we'll analyze that and you'll have a proper explanation as to why we think it has reduced.
Right, and section 4.7? What are we doing to actually, because the authority could go back and update that data for those cases that are not being recorded?
Yeah, we could.
So why haven't we?
So yeah, I'm just having a look here at 4.7.
Yeah.
I think it was because of the staffing issue, and I think that's what we're busy catching up now with, now that we have people in post. It was a significant issue. Obviously, I can't go into the detail, but we did have very little administrative support for quite an extended period of time.
And is that improved now, has it?
It has improved, yeah. We have a new person in post, although we are slowly getting used to our new system where we only have 18.5 hours of admin support per week.
Okay, I'm going to bring in Nina in case she wants to comment on
Yeah.
this area, and she's got a hand up. Nina?
Thank you, Chair, and thank you, Committee, for all of your questions and comments, and for the officers for the responses. I've just made a couple of notes, and Steve actually answered some of it just before about the move to a new system, the gaps in administration support in what is a very, very small team. This is just a couple of people. So just to give you a kind of an idea of the number of people dealing with these complaints, etc. And what the report also shows you is the complexity of, and Councillor Chloe, as you said, not just the complaints. There's learning from the good and the bad, isn't it? So the feedback that we're having is very, very complex and takes a lot of time. And it's a very small team and also involves all frontline practitioners. I've taken away a couple of kind of actions for myself and the team, Chair, if I may. But there's been a couple of queries on the data, etc., and also queries about the action plan and targets. We're happy to take an action away to provide that detail to you as soon as we can, September, October, for whichever meeting we can provide that for to suit your agenda. So I'm just happy to agree those and make sure they get that back to you. And I take on board the challenge over the targets as well, Councillor Gareth, and we will look at that as well to make sure that we are challenging ourselves appropriately, because I agree that this is an area where we want and we will need and we will drive forward improvements in terms of compliance.
Okay, thank you. Right, thank you, Steve.
Thank you, Chair.
And for Sharon and Adam and Nina also for contributing. Councillor Shan, did you want to say anything about this?
No, Councillor Amanda, I made some notes of points I wanted to make, but they've been covered by other people's input.
Right, okay, we will move on to the next item then, which is the capital and revenue outturn year end 24-25. I don't want to spend too long on this actually, because I'm quite keen to get on to the assurance review for children's. And I think it's a very high level document about the whole of financials affecting the whole council. So we're only obviously going to focus on adults and children's. But I think there's a couple of high level questions that we would like to ask. Nina, Jackie, Amy, I'm not sure how you've planned on presenting this, but it would be good, I think, just as an overview from you guys to know, is this outturn report the same position as what you expected when we looked at the budget earlier this year? Were there any surprises, or was everything still as you envisaged? And just, you know, can you just give us a few minutes just with your key headlines on this? Other than sort of cost reductions in children's, which we've, as a committee, have highlighted as something we just want to ask you quickly about. Nina?
Yeah, Chair, I haven't prepared a presentation or anything for this. As you said, these are the overarching council kind of reports that have been forward to Cabinet and beyond, etc., in terms of the financial outturn, in terms of revenue and capital. Happy to take any questions that you have. We've got Adam and Sharon and colleagues from finance here, Jackie and Amy, this afternoon to answer. In terms of the revenue, we include within the report any changes that happened. There was some additional grant funding that came into the services, which is recognised within the report as well. In terms of things I would probably pull out is in terms of cost efficiencies delivery. The services mitigated where possible any unachieved cost efficiencies that were within the reports, etc. And you could see that information within the detail, but also is included in one of the appendices is the work that's ongoing to deliver those now in the current financial year. So happy to answer any questions on those. But there's a lot to go through, and I'm happy to kind of just move to the committee's questions if that's okay.
Yeah,
Chair.
that's fine. And I just wonder, just a reminder to the committee, please, can we keep this fairly high level? Gareth, if there's any sort of discrepancies or mistakes that you've noticed, can we maybe jot those down and put them in
I'm
the
not
chat?
picking them up, Chair.
Okay. And I just before I come on to Gareth and Chris, I think my question would be to Sharon and Powell about the children's cost reductions which have been rolled over. And, you know, can you give us your view on the achievability of those, any assurances you're able to give, or how positive you're feeling about whether they're achievable?
Thank you, Chair. I think, well, obviously you can see the figures for yourselves in terms of the reporting. I think in terms of the position that we find ourselves in for this financial year, you'll note that there's been a number of years where unachieved savings have rolled forward into subsequent years. And so there is now some legacy debt stemming back to 2023, which is incurred in that unachieved savings in terms of rolling this forward into this year to actually be achieved this year. So that immediately comes with a pressure in terms of when you look at the overall cost of placements, which is where our biggest expenditure sits. Last year alone, that overall expenditure for placements rose by 2.6 million in 1 year. So that is a huge pressure in terms of this financial year. And the market for placements remains very, very buoyant. So there is a national shortage of residential placements in particular across the United Kingdom. And those providers are basically now seeing that as an opportunity to increase their fees wherever they want. So some of our higher cost placements are now reaching upwards of £15,000 a week. So that therein remains a real consistent pressure for us to monitor, to navigate, and also to achieve the savings that have rolled over to this financial year. So the assurance I can give you is that we scrutinise and we look at every single placement that we have, every single placement cost. There's a lot of mitigation, which is highlighted in the report around accountability of signing off every single invoice, which actually sits with myself. So no matter how big of a sum of that money, everything comes through the head of service channel. So we're also looking at our close to home strategy. So you'll be aware, because we've presented that at committee before. So we're looking very much at where we can safely do so is return children back to their parents or to family members, We're also looking at our special guardianship order, which is a different legal order that enables a caregiver to have that parental responsibility for that child rather than the local authority. So we're looking at investing in that team to try and kind of reduce the number of children looked after and offer them better outcomes, better permanency plans, living within their own family environments. So there's lots of, and you'll be aware of the fostering framework, which is another area where we're looking to really try and nurture, invest and grow our own foster families. So when we need children that need to be looked after, which can happen at any time for a multitude of different reasons, we've then got that resource that we can draw upon ourselves. So all our plan, which is around our integrated business plan, sits across and wraps around the service in terms of better outcomes for children. What I can't completely assure you on is that increased rising cost of external provision around placements when we need that, and that upward cost trajectory that's happening. You'll be aware through Welsh Government's legislation and policy, they're looking at a whole agenda around not-for-profit, which is about removing profit from care. So it is about getting providers actually not to be charging those higher cost provisions and to reduce that cost. So that will help and it will navigate across the next couple of years until that's fully implemented by 2026. But we're still in the very early stages of that. So right now, the market is very buoyant around those placements. So the assurance for you is that, we look at all those individual placements, those individual high costs. But what we can't do is when we need that child to be placed in a very safe place, with specific needs that wrap around whatever that is, I can't actually assure you that we won't be under significant pressure by having to source something that's higher cost. Does that make sense in terms of where we're at right now? So we're working really hard on trying to reduce those and achieve savings. We have made some headway already in Q1 of this year, but actually in terms of the totality of that, I think it's a big ask for us because of the rolling over and historical kind of accumulation of those unachieved savings that have rolled into that ongoing pot. So
I think where we're at,
really
Sharon, is that when we come to look at the budget towards the end of this year, is that we're going to be really concerned that any savings that you're pushed for as a service next year are, how realistic are they? Are they just putting a ridiculous amount of pressure on the fact that you've already got this rollover? And from a strategic level as a council, that, is that being fed up to the not just because your finance officers are fully aware of that, but that needs to come down from David and Jane and the very top to make sure that that is being taken on board. So yeah, thank you for those comments. I think I'm going to move on. But yeah, no, thank you for being so candid about that. Councillor Gareth.
Yeah, just pick up a couple of points that Sharon's just made, Chair. The not-for-profit, I think you said, comes in fully implemented next year, 2020,
yeah.
2026. Is that from April 26? And does that apply to providers in England as well, or is it just providers based in Wales?
Yeah, so it's legislated now. So it came in earlier this year in 2025. And the plan is to try and move over the next few years to actually reduce that profit out of care in Wales in particular. It isn't equitable across the English borders, but I think is already some national conversation happening in England about moving to a potential very similar position. And in a way, that would be helpful then in terms of Wales, in terms of going forward as a United Kingdom with that, because Scotland have already moved towards that position.
I think the problem is, Sharon,
there's
a lag time, isn't there, between now and then, and that's having an impact on the market who are doing what they can now. And just to interject, sorry, Gareth, Nina, is anything being done at a political level, at ministerial level, in terms of this time now between now and when it comes in? Because we're just conscious that the providers are seeing an opportunity to potentially raise costs now so that they're not hit down the line when the not-for-profit comes in.
Yeah, the not-for-profit is as you can imagine, a priority kind of topic amongst directors of social services, and there are regular conversations with the Welsh Government over the concerns around it. And Sharon would be having the same with her kind of counterparts as heads of service across Wales as well. So we are feeding back, and I'm making sure that we're in those discussions and raising concerns where there are concerns.
And is what I said an accurate analysis?
Sorry, what was that then?
That in terms of this period between now and when it comes in, costs are going up, because providers are potentially getting themselves their ducks in a row.
I think what we can say and evidence is obviously that there is a clear increase in placement costs, and so that is accurate, isn't it? And Sharon's shared that information and data with you.
Thank you.
Sorry,
Gareth.
Yeah, so can I also say, Chair, I in another role, I deal with officers from about 7 or 8 English authorities, and each of the managers I deal with say SEN, SEND is both in education and in social services, cost of placements is a major pressure. It's a common theme across all the authorities. Can I just pick up a couple of questions around Appendix A on capital, and this relates to adult services. There's a carry forward budget of 677,000, but in the narrative it says there's a £400,000 carry forward for learning disabilities that's been refilled into 25-26, and then 385,000 carry forward into 25-26 for Paris-owned care homes. Those two total 785,000, but the budget roll forward is 677. I just wondering, are we satisfied there's enough budget to meet that £785,000 demand? And a second question for Sharon. I noticed from the overall budget figures, there's a £10,000 capital spend in children's services for the year. I was just wondering what that was.
Who wants to come in first on that?
I can answer the 10,000. That's to do with our 16+ accommodation. So we're building springboard type accommodation for anyone that's age 16+ to actually access, is to do with that.
Yeah, thank you.
Chair, would you like me to come in terms of Councillor Gareth, you asked about in Appendix A, isn't it, in terms of the capital expenditure for adults? I think the query was whether the role, sorry, could you just repeat it for me now? Because I've got it on screen now.
The remaining budget, 677, has been rolled forward into 25-26. But if you look at the narrative, there's a figure 400,000 that appears to be needed to be met in 25-26 for learning disabilities, and 385,000 for Paris-owned care homes, which totals 785, which is £110,000 more than we roll forward.
Yeah, I don't know if one of my finance colleagues can answer that, Gareth. I might have to take that away and double check, but I haven't had any concerns with the capital budget raised with me as within the current financial year. But I don't know if Jackie or Amy.
Yeah, do you want me to come in?
There, thanks, Jackie.
The budget remaining is what was actually left between the budget and the actual, but we knew that we needed a little bit higher of a roll forward, so that's why it's higher in the wording.
So has that been implemented now in the capital plan?
Yes.
And the relevant environment documents
will be done, yes.
Okay, okay, fine. Thank you.
Thank you.
Thanks everybody on that. Councillor Chris.
Thank you, Chair. Mine was of the same point in relation to the children's services, and I think the responses to Amanda's questions are helpful because it is the rollover, and that's what I seek clarification to. And I know in other meetings I've been given the assurance that these savings will be achieved, but are we seeing a growth in demands for children's services coming in, and how assured what's our modelling around that potential growth going forward, and have we got certainty about that on there? Because my understanding is that we'd have to go to the risk budget if there was any additional costs incurring on there, and they seek clarification on that. The other thing is in relation to children and them making an informed choice around some of the options, how much co-production goes on with them having a say of where they go in relation to some of those services, or is that totally with ourselves making that decision? Because sometimes those specialist services are more expensive, but if a child then doesn't want to go there, how is that then managed? Is that part of that process?
Do you want me to respond, Chair?
Sorry, I put my mute on because my dog was barking. Just on those questions, I know if they could generally be answered, but on the one to do with like projecting and demographic, I know that we do get quite a lot of information at budget time about how Jackie and the team do project looking at demographics and how we then plan. So that could just be taken quite quickly, but if the rest of the questions could be answered, please.
But if that's the case, Amanda, then there should be some certainty of the figures that are going forward, that demand may not then be an issue of material factor, because it's already been built in, and that then gives us more assurance that the savings that are projected to be made should be.
So it's a question of how do they reflect on those?
The model is.
Yeah, which
Which
okay.
then stems into the whole of the financial model moving forward, which I know has been raised in other committees about that going on there.
Okay,
So it might be that, oh, sorry, Chair, it might be that Jackie wants to come in and talk about the modelling and the figures, and then I can come in and talk about some of the other areas if that's helpful.
Jackie?
Okay, so the modelling is done on the known children at that time and also on any past trends, but we really don't know who or what is going to present during the year or how complex a situation becomes. And as Sharon said, the actual cost now of a placement is take it or leave it. The negotiation days are over. So we are seeing increased costs rather than increases in numbers.
Okay.
And we are trying to do more, aren't we, Sharon, around the intervention and prevention to stop the numbers increasing.
Yeah, and that's the yeah, no, absolutely. So the work that we're trying to do in terms of our closer to home, but our right help, right time, which is the starting block, is about trying to reduce the number of children that become looked after at any given time. And if you look at our monthly figures, those monthly figures are coming down month on month in terms of either preventing those children becoming looked after, but actually returning those children home that are currently in placements. What we can't ever say is what that need is going to be at any given time, or what the complexity of that need is going to be at any given time. So Jackie's talking about modelling. You model on your numbers that you've had, your complexity that you've had, but those rising costs. And if you just look at last year alone, when the overall placement costs went up by 2.6 million, that is a phenomenal amount of money that then becomes a pressure within your overall budget. So it's just one of those very fluid situations. So what we do to try and mitigate is work on our close to home strategy, which I've already touched upon, and we look at that prevention agenda of preventing that child becoming looked after. And then in terms of the co-production element, what we're trying to do is kind of work with children and families around what is the best possible plan for them. So there is always co-production in that process. We have have independent reviewing officers that oversee every child's care plan, and they are independent, so they will navigate with that family, with us, in terms of looking at whatever that care plan might be. Children also have access to advocacy, so there's a whole kind of wraparound support package that happens for that child in terms of what is the best plan for them, where, in terms of location, whether it's in a residential home, whether it's with foster carers, whether it's actually going back home or it's with another family member. So all of that will get explored all of the time. What we're also trying to do is grow our own residential homes. So you'll be aware that we've got some that are currently open. We very much plan to try and reopen our other homes that we've got currently mothballed open this year to extend our own internal residential provision. That isn't necessarily a cheaper option than other residential homes, but nevertheless, it is about making sure that every child's got the maximum opportunity to remain in Powys where it is safe to do so. So all of that kind of intertwines really and interlinks in terms of what we're doing in terms of our business plan, and then how we're trying to manage that cost and that cost efficiency that wraps around. What we can't do is just absolutely say 100% today that we can give assurance on all those savings being met, because there's all of those other complicating factors
Yeah,
wrapped
no,
around
we
it.
appreciate that. Just Sharon, I know we're going to come on to the assurance review in a minute. And I do want to just move on from this slightly within the next few minutes. But when you talked about the Grow Our Own Homes, one of the recommendations in that assurance review is to look at projects which can be moved forward with pace. If that is something which you've identified, can somebody just remind me that when we come on to that in a minute, I would like to hear more from you on that, if that is the
Okay, no
case.
problem. Yeah, of
And
course,
on
that's
that note,
fine.
Jackie, did you want to come back in on
Yeah,
that
I think
quickly?
I was good. I should have said previously that during last year, one child remained in the same building, but the business passed hands 4 times with an increased cost.
Right, okay. And then you've got all the scenarios of whether, even if you do want to move that child closer back to home for financial reasons, it's not necessarily in their interests to do that. So, okay, Gareth, I'm going to take this as the last point, please, before we move on to the next item.
Okay, then. Thank you, Chair. I'm going to make 2 points. Well, I'm going to ask 2 questions. The first one is, and I think that one may be for Jackie, is how much of the 3 million budget held at risk was used in 24-25 to support the adults and children's services cumulatively between them. And the second point is, I think, is more one for Sharon, is around, I've just looked at it, the number of looked after children reduced by about 16% from May 24 to May 25. But the cost of placements hasn't really changed. That stayed stable. I see that as a massive win for us, the fact that you've actually reduced the number of placements by 15%. How easy would it be to get what the reduction in the cost of placements, or what the cost of placement would have been if those 15% had remained looked after? I don't need the answer today, I don't think.
Yeah, if you don't have that to hand, we're happy to take that in an update.
Shall I come back in? Yes, we can find the cost if they hadn't, if they'd remained in care, but some of those will be nil cost to the authority anyway.
Yeah, I would understand it's the low hanging, it's the ones who've got the lower needs and once they gone back closer to home, etc. But I think it's just something that my perception is we're reducing the number looked after, but those with the more complex needs are staying looked after, and their costs are rising. But I think as a committee we just need to have that clarified.
Yeah, we can bring that up.
And
give you that information.
Just on that point as well, on our enhanced foster care offer, which isn't fully in place yet, it would be good to just again as a reminder in the future to kind of know whether, once that is in place, whether that is having an impact on enabling, because a part of that is for foster carers who have a wider range of skills, isn't it, Sharon? So whether that's having an impact on enabling some children to be placed into foster care rather than in high cost residential. So I think that would be a financial that we can measure on that going forward. Anyone want to come back on any of those other points that Gareth's made before we close off?
From the risk budget was 2182 million.
Okay. So about 2/3 of what was held came into the services.
Yeah.
Thank you.
Okay, great. Thank you for that. And when can we expect the next quarter?
Finance-wise,
Yeah.
it's going to
I think it's going to.
CL.
Is it September time, Jackie? I
Yes,
think.
it is. Yeah, it's after the summer break, isn't
Yeah.
it?
Yeah.
Okay. Nina, can we pick that up as to when we look at that, what we
Yeah.
want to go on the work programme, which quarters as well?
Yeah, absolutely. I'll pick that up with the team. Thank you.
And you've got your hand up as well.
Sorry, I was just coming in to answer that question.
Oh, okay. Okay, great. Right. Well, if we can move on then, please, to the Children's Services Independent Assurance Report. And we have in attendance Steve Walker, who did this review and report. So welcome to Scrutiny, Steve. Nina, Steve, Sharon, I'm not sure how you want to present this, but just to say, we have read the report and we've read the recommendations, and also you've got the actions table as well, which is all incredibly interesting. I'm not sure whether you want to give us sort of the headlines rather than I don't really want you to go through every single recommendation because we've read them and we've got probably have questions on specific ones. As an overarching question before you come in to introduce all of this, it would be really good to hear as to how this came about in terms of this taking place. I'd like to also ask Steve if he could, introduce his background and his role in all of this, and then we'll go from there, please, if that's okay.
Thank you, Chair. If it's okay, if I start off.
Yeah.
Firstly, yeah, as you say, a real big welcome to Steve Walker to come along to Scrutiny this afternoon. Steve was approached by the Chief Executive to undertake an assurance check into children's services. So to come in, have a look at children's services, have a look about what's working well, any areas for improvements, any recommendations, etc. So it started, has been initiated by the Chief Executive. I think Steve is, he's, if possible, Chair, and with your agreement, would like to just perhaps present how he did his work and just a brief summary of the kind of main headlines. And then Sharon and the service have prepared a response and kind of action plan in response to the assurance checks. It'd be really great perhaps if we could take you through a very high level of that as well. But equally, led by yourselves.
Is that the table that's the second document, is it, that we've seen?
Yes, that is.
Just before Steve comes on, and we're really keen to hear from him. When you said that the Chief Executive came up with this approach, is it something that was commissioned? And if so, are you able to share with us how, what was the cost?
Yes, it was commissioned, but it wouldn't be appropriate or be commercially sensitive, the cost of it, so we couldn't share that.
Are we able to be provided that with it confidentially as a committee?
Yes, I don't see why not. Thank you.
Okay, thank you. And on that note, welcome to Scrutiny, Steve. It's really great to have you here, and thank you for and this opportunity and for your report.
Thank you very much, Sharon. I'm really pleased to be here. Am I coming through loud and clear from Leeds?
Yeah.
Thank you very much. I've heard what you said, and hopefully, if I can work with the technology, I'll just give you a very quick overview. As you've recommendations, I won't go through them in detail. But what I will do is give you a very brief introduction to myself. I qualified as a social worker in 1984. I've worked for all of my career in and around children's social care. I was a research fellow at Holloway University of London for 8 years, and an inspector with the children's side of the Care Inspectorate Wales. I was the head of children's services in Swansea between the end of 2008 and 2011. I then moved to Leeds initially as Deputy Director for Children's Social Care, then subsequently became Director in 2016. I stepped sideways there in Leeds to set up the Leeds Relational Practice Centre, which was something that was funded by the Department for Education to support sector-led improvement. Leeds was one of 3 local authorities in England that was funded to see whether or not we could actually improve the quality of practice and outcomes for children in other authorities. I'm trying desperately to retire with limited success, and I'm currently a approved commissioner, children's commissioner, and an improvement advisor for the Department for Education in England. To undertake the review, I read over 200 documents which Nina, Sharon, and their teams kindly sent me. Everything from inspection reports to council and directorate plans, to service improvement plans, performance reports, audit and quality assurance reports, reports to full council and scrutiny. A really excellent range of documentation. I also came down and had 3 days on site where I met with a wide range of staff, different focus groups. I also visited the front door. So I met with everyone from Sharon and her leadership team down to unqualified staff working in early help. So really everyone that I met with was extremely professional, extremely helpful, and extremely open. So I feel I got a good sense of where the service was. To actually structure all of the information that I got, I used a framework that was developed by ISOS initially in 2016. They were commissioned by the LGA in England to look at what were the factors that actually supported improvement in children's services. And they came up with those 7 factors, which will be, if it's the same on your screen as in mine, on the left-hand side. So strategic improvement, leadership and governance, engaging in and supporting the workforce, engaging with partners, building the supporting apparatus and fostering innovation, and then of course judicious use of resources. They revisited that research in 2023 to see whether or not those factors continued to be relevant, and they found that they were, but they also emphasized 3 other things which were critical, which was the quality of partnerships, the voice and influence of children and young people in terms of shaping services, and the ability to shift culture within the organization. So I used that to structure the report. In terms of the headlines, I think that the key headline for me was that children's arrangements for children's services are safe. You have a experienced, stable leadership team, that actually have a very good understanding, of the area. They have a good understanding of the needs of children, and actually, know what they're doing. So hopefully that's reassuring. There's a really clear line of sight, from practice, to the chief executive, to the lead member, and reading the quality of performance and reports that go to you, to scrutiny as well. So I think that there is that strong governance arrangement in place. What I found was a service that knows itself well. So there's a good understanding of the challenges that are facing children and young people in power, the good understanding of the challenges that are facing individual services and individual areas, and a commitment to try and improve that, and to innovate. It's an improving service, and a service that I think will continue to improve. But there were some opportunities for improvement, which I hope I highlighted my recommendations. But again, a key thing for me was that there was no need for reactive action. I didn't come across anything in terms of practice or an area of service or something that Sharon or a member of our team were planning to do that I thought, oh my God, yeah, stop that. Yeah, that doesn't make any sense, or that's unsafe. So, you know, there are opportunities to improve and develop. And having been a researcher for a number of years, the one thing that we're very good at doing when we're researchers is telling you things that you already know. Yeah. So a lot of what I think I was saying to Nina and Sharon, I think they knew. But I think it's always helpful when you see it, yeah, from or hear it from outside. So I don't think it'd be helpful to go through the recommendations, you know, so I'll just stop, yeah, at that point. And if I can stop sharing screen. Right. Hopefully that's all disappeared now.
Thank you, Steve. It's a really interesting report. I think just on what you said just then about it's helpful at telling people what they already know. I think that was one of my questions for Nina and Sharon. Really, is it all everything you know, or were there some, you know, surprises in here, or areas where actually there's a couple of recommendations which suggest looking at other models? Are they things that you hadn't, you know, thought of, but it's now helpful to go and look at those as potential options, or to look at whether they work in Paris? Or was it all stuff was already in the pipeline?
Do you want me to come in first, Nina? Okay, so I think in terms of social work practice, I think it's important to recognise that it never stands still. So there are always new things to learn and develop and be creative and innovative about. And that's how it should be, in terms of just always looking and striving for the best possible outcome for any child that we kind of share any kind of knowledge around. So for me, we have what we call our signs of safety practice framework, which we developed on the back of a really poor inspection back in 2018. And that framework actually has been embedded in practice for a number of years following that. But actually what Steve kind of gave me an opportunity to think about was to reflect on the signs of safety framework, to look at where maybe some other authorities have kind of taken it in a different way, or whether or not we could look at maybe a practice framework that would just further strengthen what we're doing right now. So for me, it was very much just me being really open to those ideas and suggestions. There were some new things that I hadn't considered before, so that was really helpful. And following the conversations, I have made contact with other local authorities, predominantly in England, but picking up on Steve's themes to have those conversations about how could we even make ourselves better in terms of the framework and practice that we're doing here. So it's opened a lot more doors to kind of just thinking and considering about other things, which is really, really helpful, I think. So the point that you made earlier around residential homes, so I'll just kind of pick up on that now. So you'll see our action plan. So I'm not going to take you all through that step by step. You can see exactly, we've picked up the recommendations. What we're doing now is kind of just analysing those recommendations, thinking about what are the quick wins that we can kind of quickly embed, what are the things we just need a little bit more time to consider and reflect upon, and what actually and where do we want to go to. So there are some overarching themes that we're considering, such as strengthening the practice framework, like I've already touched on. There's also another area in terms of our front door. So talking to Steve and thinking about how some other local authorities operate, we're doing a little bit of research ourselves now into the model he suggested that might be appropriate for us here. So at this moment, we're just
Sharon
kind of
seems to have
testing that
frozen.
out, gathering information, considering whether it is something we want to invest in or not. Have I frozen?
Your face is frozen, but we can still hear
internet
you. Oh, there we go. It's caught up. It's caught up.
My face is frozen, but my voice. So yeah, so we're looking at the recommendations and kind of doing our own analysis about those things that actually we want to take further forward. Some of that is reflection and some of that is quick wins. So one of the areas that we've been able to champion, which is something I've wanted to do for quite a while, is really put Powys on the map in being a foster friendly organisation. So it's not just me and Children's Services talking about being foster friendly, it's the whole council approach to being foster friendly. So I'm really pleased to know that the Chief Executive Officer has taken that on board, and actually that's been reflected in the new corporate strategic equality plan. And so I think that's an area which I think will just grow in terms of us as a council having that as an overarching vision. Another area is putting children right at the heart and forefront of the council. Again, that's something I've really wanted to do, but this has been an opportunity to think and consider with Steve, what can we do and how can we do that? So there'll be, again, the Chief Executive's taken that on board. And again, that's been threaded through the new corporate and strategic equality plan. So that's really helpful. So I think there's some overarching value-based and strategic thinking and vision that's been helpful to take through from a council perspective, right the way through down to some practice areas that we can test out and think about, is that going to work for us here? What Steve has said to me is that, you know, it is to break down, because when you look at Children's Services as a whole, it's an enormous part of the council service and model and delivery of what we do. But actually, we're in danger of trying to do everything at speed all of the time. So he actually gave me that opportunity to slow that down a little bit and think about what are the key priorities, what are the things we absolutely want to do first, what are the things we could do in a phased and staged planning approach. So that's been really, really helpful. So the residential homes has come into that. So we have now secured some Welsh Government funding, revenue funding, which is 720,000 in terms of the not-for-profit agenda. And that is going to enable us now to think about the residential homes that we've had to put on hold and what are our next steps going to be? What do we prioritise first? What do we do in a phased approach over the next couple of years? So we're at that kind of just that analysis stage of that. A report will come through September and into scrutiny probably early October in terms of what those next steps and stages are going to be. So everything that Steve's highlighted, we've considered, we've reflected. Some of those are already on a journey forward. Some of those things are needing a little bit more time to think about, but we have taken on board everything that he's kind of recommended, really, and just to consider for here.
Thanks, Sharon. I think just a couple of points on those actions then. It would be really helpful, I think, for us to hear further down the line then, maybe in 6 months' time, where you're at as a whole in relation to the actions. And then particularly on some of the actions, so taking that one about identifying projects which you want to move forward with at pace, it would be good to know what those projects are that you have decided to focus on. I presume, you know, it's a case of you want to do a few things really well rather than do everything, you know, when you can't see the wood from the trees. And I completely agree with that. And I know, you know, when you manage such a large service, you don't want to be overwhelmed all the time, do you? So that's helpful. If I could come back to Steve then, please, and councillors, if you can start thinking of questions as well. Steve, I just to make a comment really on how there's a couple of us online today from councillors who have been here since 2017. So I'm really pleased to see your overarching comments on the positive comments on the service, because from my personal perspective, and I'm sure I can see Councillor Ange, I'm not sure if Councillor Carl is still online, but we've been here since 2017, and I would personally comment, I'm not going to speak for the others, that the service is vastly different since then in terms of culture, well, predominantly in terms of culture, and leadership as well. Stability with leadership has been absolutely, you know, key over the last 5 years, and it's moved forward really positively. So I just wanted to thank you for putting that in your report at the outset. And then the other point I just wanted to make really is from obviously you said you'd read some of the scrutiny things that have gone to scrutiny, and I just wondered, you know, how have you found, I don't know when you dialed in today, but how have you found scrutiny today in terms of the issues we've looked at in children's, and are there any areas when you were doing this process that you thought actually I would expect Scrutiny to do a deep dive here, or are there any reflections you'd like to make on how our involvement works with the children's department?
Okay. I mean, a couple of things. I mean, it would be manifestly unfair not to comment on the scale of improvement that's happened. Yeah, because I, went back and looked at reports over a series of time, and I think what Nina and Sharon and their teams have done have made some very sensible, pragmatic decisions, which have stabilized the service and taken it forward. I suppose my reflection in the discussion I had with them was, you're now in a position where it's really stable. You can think, you can think bigger.
Stop firefighting.
Than where you are now, and you don't need to do everything at once. And also, one of the things that when you've been around as long as me, you've got a lot of things wrong. And so one of the things I've been able to say that in Leeds, we opened loads of residential homes. They were all the same. Yeah. Everyone had the same statement of purpose. 7 homes with the same statement of purpose, which was basically, let's look after kids here. Yeah. Right. Rather than put them out. That wasn't good enough, because all we did was kept them there from 12 to, 16, 17, 18. It wasn't your job is to get them ready for family life. Yeah. To support them to it. So, I was very concerned that if we're going to have a statement of purpose for each home, we need to be really clear about what we're asking staff to do, and then we can judge how effective it is. So we had one whose purpose was to bring children back from outside of the authority, get them ready for an in-house foster placement or residential placement. And it was a specialist placement. And then one that was edge of care to prevent children. You can't always prevent them coming in, but you can prevent them coming in to long-term care. Yeah. And you can sometimes, work with parents and the child to get them home quickly. So that educare service that I know you've got a very good one in Powys, but it's about linking that with one of the residential homes. So there were some real opportunities to do that. In terms of scrutiny, the quality of reports that you get is really high. Yeah. So you're well served in scrutiny. I've been here for the meeting today, and you've been very well focused. Yeah, I've been to lots of scrutiny meetings, and it's very easy that before you know it, you're off somewhere where you never intended it to be, or somebody has got something they're going to bring up in every meeting, and here it is, yet again, it's around about the education of I don't know, disabled children, and here we are talking about the budget, but we've managed to get back over there. So I think it's been very well focused. And I think the level of questioning is really good. And again, you've picked up on areas where, right, there's a lot going on. Can we get something back on that? Yeah, in 3 months. And also the bit about, I listened earlier about the whole complaints report. Yes, of course, there is a statutory requirement to have a complaints report, but that could be part of a bigger report that says, yeah, we've, this is the context of the service. These are the compliments had. Yeah, these are the complaints. This is what we've done as a result of both of those in terms of strengthening the service. So I thought that was because it's the problem with the complaints report, which is just about complaints, is that's all you hear about. So,
and in terms of your recommendations, then, do you think there's anywhere that you could actually see scrutiny would be helpful in giving a bit of a deep dive into those as they develop?
I think that there is something for me which I've spoken to Sharon about actually looking at the what leads children to come into care in Powys. Yeah. So and how well our partners, I know it came up earlier, somebody mentioned SEND, and issues there. To what extent is that an issue that is health, and to what extent is it an issue there for children's services? But we know the ages of children coming into care. We know yeah, the areas that they come from, the different wards that they come from. But if you look at the ages of children coming into care in Powys, the majority of them will be, yeah, I would suspect in terms of percentage will be under 5. So those are factors, yeah, affecting parenting capacity. You know, and again, we know that there'll be drug and alcohol misuse, there'll be domestic violence, there'll be parental mental health, there'll be poverty, you know, significantly more children, 13 times more likely to come into care if you're from a poor area than if you're from an affluent area. That doesn't mean to say poor parents can't parent. It just means the pressure on you to parent is incredibly, yeah, you know, is a lot more. So I think there would be something about trying to get an engagement with partners to look at those kind of issues. I mean, there was one thing that came up, and I did mention it in the report, although it's not really anything for sure, which was there is nowhere to get a child protection medical in Powys. Kids are having to travel for 2 hours in a car. Social worker is going to have to drive with the child and the parent in a car for 2 hours. Yeah, to see whether or not this injury, yeah, is accidental or not accidental. That is not a car trip that I would want to make. I don't think any of us would want to make, either as the child, as the parent, as the social worker. And but that's unacceptable. Health have got to get that sorted. They've just got to get that sorted.
So I think then, as that where you've made that comment under your recommendation, when we come back to look at that, it would be interesting to know then as how has Nina and Sharon picked that up with the health board and what the plan is for that.
And I think an opportunity to look wider at are, you know, other things that other parts of the council could be doing that would help the children's agenda. Because the problem that we've got in children's is we are literally left holding the baby. You know, that if parents don't get the mental health support that they need and cannot look after the child, it ends up, with children's services. And getting them back home will again depend on the services which are provided by partners and others. I also thought quickly there was something around, Sean talked about the agenda around a foster care offer. And again, I wish I could take credit for it in Leeds, but it was a project officer who'd moved from children's into the corporate centre, who said, you do know that staff have a whole range of benefits that they get, you know, the 10% discount at supermarket or whatever it was. We could offer all of those to foster carers. You know, we could be asking some of our big partners, would you be a foster friendly employer?
Yeah, we've raised that point, I think, because we have quite a lot of benefits that are given to like people like veterans, and I think we've asked previously whether those could be applied to foster carers as well. So, but it's I think that needs to be.
It just really, for us in Leeds, it
enhances
really raised the profile.
Yeah. Okay, thank you, Steve. I'm going to come to councillor questions now. Councillor Chris.
Thank you, Amanda, and thank you, Steve, for the report on there. I just want to pick up, let me get the right page now. So it's on page 3 of the report. It said in the past 12 months, there's been a 40% increase in the number of children subject to a child protection plan. I agree that would be significant, and yet that feels like it's been skirted over, and I just wanted really to get an explanation around it, because the impact for practitioners and their workload and then their support that would then be required would be quite significant in my view. So I just wanted to get some clarification around that.
Is that something you can comment on, Steve, or is it more for Sharon and Nina?
I think it's probably more for Sharon and Nina, but I would say
I can come in if that's helpful.
It's important to recognise the impact of COVID. Yeah, and the lack of support that's been there for both parents and children during that time that we're you know still dealing with now. But I didn't know if Sharon wanted to to come in?
Yeah, I can come in. Yeah, so you get our monthly performance reports. So in each of those monthly performance reports, you will see the numbers of children on the child protection register month on month. So last year we did see a significant increase to the child protection register. Now, the child protection register is where a child is assessed to be at risk of significant harm by the multi-agency partnership. So it isn't just children's services. So referrals come in through the front door around safeguarding concerns around a child. That referral could be made by police, health, education, third sector, a family member, a concerned neighbour, or anyone in the community. We then have a duty to investigate that information in terms of that child's situation. And again, that's done very much in parallel within the multi-agency partnership, predominantly with police, but actually it does include health and education or any other service that might be wrapping around that child. To pick up on the points of COVID, I think Steve's actually right in terms of that trajectory and the impact of COVID. What we are seeing with a lot of younger children, so children that would have been born during the pandemic or are now coming up to school age, there's also a lot of vulnerabilities around some of those children, particularly the impact of poverty has actually been quite considerable in some areas across Powys. And also we've had some very large sibling groups within that cohort as well. So some of those sibling groups have had 7 children in them and some numbers upwards of 5. So again, if you get maybe 2 or 3 larger families, that can significantly have an impact in terms of that overall number. So you are right to kind of pick that up. It isn't something that we have not looked at. It's absolutely something that we do prioritise and we consider month on month. And one of those reasons is the threshold right around safeguarding, is the threshold right around a child's name going onto the child protection register? Have we actually got an agency or someone that actually is thinking they're being a little bit risk averse around what actually might be happening for that family? But actually, if you look at our performance data, you'll see a high number coming onto the register, but you'll also see a high number every month going off the register. And that is as equally important in terms of that being fluid. So what that tells you is the intervention while that child's name's on the register is looking about de-escalating, making sure services are supporting that family, empowering that family to be as safe as they can be in terms of caring for that child with the view of de-escalation rather than escalation. So you do expect that to be a fluid register, but it is something we have been looking at. We've also been comparing and contrasting ourselves with our regional local authorities, but also on a Wales national perspective as well. So I get monthly figures from a Wales perspective, so I can track and look at where we're at in comparison to population percentages against other local authorities. So we definitely saw an increase. But actually in conversations with police and health professionals, it was to do with complexity and some differences that we had here in terms of safeguarding. And if it's helpful, I'm quite happy to bring a report at some point in the future around child protection registrations and what that means in terms of... I think,
Sharon, we're going to change our approach slightly to how we deal with the monthly performance reports, just in case anyone is worried. We're actually not going to look at those today. And so it may be that if that's obviously those figures are in the performance report. So I think maybe if we identify that that's something that we do want to look at, we will take that up with you.
I'm more than happy to do that.
Yeah. I'm just slightly conscious of time in that we've got about 15 minutes left of time on the agenda. And there's councillors got a few more questions. So Councillor Gareth.
Thank you, Chair. Can I first of all thank Steve for the report, and especially and I particularly like the 5 paragraphs he's got right at the start on the executive summary, which I think, within 2 minutes of reading that, you can actually get a reasonable understanding of where we are, especially the first 7 words where you say it's a safe service. That gave me the reassurance that I wanted to see. And I would actually suggest, Chair, we make a recommendation that all future report that comes to us has that sort of executive summary where appropriate, because I think it's so useful to have that. The second point I wanted to make was just to thank Nina, Sharon, and the whole team within the service for the work they've done over the last 18 months. And I think we should actually ask them to put a message out to all staff in the service to thank them for all the hard work they've done over the period. I can remember about 21 months ago when Sharon was interim head of Children's Services, she came and did a presentation to us on the budget. And being an accountant, I was overwhelmed by her understanding of the budget. And
she hit the ground running.
Well, I think she did more than running. I thought it was super, and I thought, well, yeah, we got a star here. And I think, yeah, I just thank, but add that thanks, Booker. Can I just ask one question for clarification? Well, it's not a question, and I think this may be for Steve to liaise with Jackie and Amy around the numbers on page 16, because the figures quoted in there for the 24, 25 figures are different to what we had in the finance report earlier. So I don't need a response now, but I think that's something that just needs to be checked. And I don't know where this report is going from here, Nina. Is it going to cabinet, or is it just an internal report for us to consider? But I think there's a massive communication job that we should be doing. Is that the press are very quick at hitting the authority when something's not going right. But this is, in my mind, a real success story over the last couple of years.
Any quick responses on that? No. Yes, Nina?
If you want, Chair, I'll just say a few summary words at the end and I'll include a response if that's okay.
Okay, thank you, Nina. Councillor Ange.
Mine is sort of a question to Steve and to Nina as well, I think. We've lost over the last 12 months a lot of grants, not to the service particularly, but to providers of services in local areas like youth clubs and family centres and all this sort of thing. That's bound to affect the numbers coming into us. Do you feel it has a major effect on it, and should we be campaigning for these grants to be brought back in, or do you think it's just incidental, because obviously the kids weren't going to these sort of things over COVID, and having them put back on was good, and now they've stopped them again? I'm quite cross about it, but I think we need to look at whether we can get some more money from Welsh Government towards these things. Thank you.
I think that any money that is coming in to support children and to support children in communities is really, really important. I think it needs to go alongside the work that Shannon and our team does to understand the needs of children in local communities and to make sure that we're providing the right kind of service at the right time, in the right way, at the right place. I mean, it's fairly, but I do, my own personal feeling is that I think if you cut preventative services, then you will feel the effect in a few years' time. And certainly that was the experience in Leeds, where due to cuts in funding, we reduced youth services, and then everybody's concerned because we've got more teenagers coming into care. And you just got to go, yeah. Why is anybody surprised? So I think any campaigning you can do around that is, and again, I know there's a lot of emphasis within the service and powers on evidence-based interventions. So it's not let's just give money to anybody who wants to work with young people. It's are they going to work with young people in a way that's actually going to be supporting them to maintain themselves within the community.
Thank you, Ange. Is there anything you wanted to follow up on that? You've gone on mute.
I'm pressing the wrong button. No, I think he's completely right. For a long time, we've been missing out on a trick where they have cut preventative services, and we really need to bring them back there isn't the money that we're getting at the moment to bring them back, but we need, I think, as a county, we possibly could do with doing some campaigning on it, because we're such a large area to bring families together. You know, I can only go on the services that we've had in town, where you've got social workers and everybody coming into a large group, so that the kids aren't frightened of them when they see them at home, and just really simple little things like that can make a heck of a difference to a child and stop it coming into the service because they're happy to talk to people. Whereas now, again, I'm on a hill farm in Wales, they're all going to be shut up on their hill farms because there's nowhere to go. Okay, thank you.
Thank you, Ange. Just a couple of questions, Steve, just on just a couple of minor points in the report. First of all, I think you make a comment on the challenges and powers, one of them being since COVID, there being an increased home amount of families that are home educating their children. I just wondered from your perspective and what you've seen elsewhere, why this poses a challenge to children's services. And then my other question is, throughout the report that you pick up on social workers and members of the teams commenting on cases being more complex. And I think somewhere within the report I read something where, but it's not really stated what that means in terms of what more complex is. So I just wondered, did you get a feel for what is now more complex than, say, 3-5 years ago, or do you believe that that's somewhere where actually we need a bit more evidence? Is it easy for us, you know, particularly on a budget thing, to say, oh, it's costing more because it's more complex, or it's taking more time to respond to this because it's more complex? Do we need to be digging down as to whether or not things actually are more complex, or are they just different?
Great. Oh, right. What time did you want to get away? No.
Sorry.
No. In relation to home education, I think the biggest threat to children around home education is is why parents are home educating. Yeah, is that in some cases it's because I believe I can meet my child's needs better. I understand my child's needs and I want to provide them with that support. I will come to you, children's services or health, if I need anything. Yeah, and some parents are absolutely fine to do that. Others may have been persuaded because their child is difficult or because their child might be reducing overall achievement, within the school, that the best thing that you could possibly do, Councillor Jenner, is actually if you educate them at home, because I wouldn't want something, if we excluded them, it would go on your school record. And that sometimes parents are not understanding the long-term sometimes effect of children not being around other children and not being seen. So I think that's it for me. It's not about children should not be educated at home, but are we in a position to be making sure that, and I think there are national issues because we have no right of access as children's services to see children who are being educated at home.
I think there's potentially something that we need to think about as a committee as to whether we pick this up with the Education Scrutiny Committee, because I think this also ties in with the fact that attendance at school since COVID is a lot lower. So yeah, thank you for that. And also on the complexity of cases point.
Well, I look, as a social worker in the 1840s, when we were wondering about the impact of putting children up chimneys on the long-term health. I would say I don't think cases are necessarily more complex. The needs of parents or children are more complex. I think perhaps sometimes are we getting the right support, and is it joined up enough? Yeah, in the way it's provided now compared with before. Because what you will see is reductions, for example, in support staff at school. That means that children who previously would have got a lot more support to either catch up or maintain themselves in mainstream school can't do it. They're then, out of school. That then puts pressure on me as a parent, either because I'm working or because I've now got them at home and I don't know what I'm, so they're the opportunity for them to get. So I think it's understanding is what are the complexities? Then when we talk about being more complex, why? That's a complex case because there are 7 children with very different needs in it. I get that. It's a case with one child in it. So what's the complexity in there? Is it because it's drug and alcohol and there's domestic violence? Yeah, and there's a parent with a mental health difficulty there as well. That's all very complex, but those cases were there before. But actually, it was easy to get support, because very often when I was a social worker, when I first started, there were generic teams. Then you were specialist teams in terms of adult mental health. Yeah, actually, but we worked together. So I could ring you up and go, look, can I just ask you about this family that I've got, and this is happening and that's happening. So I just wonder, is it complexity? You know, can we unpick that a little bit? And it goes back to, we did a little bit of research, I'll say this, in Leeds when I started, where somebody said, it's been really interesting. You know, I've gone back about 10 years. We always take between 100 and 110 children a quarter into care in Leeds. Well, that's interesting to know for a start, because if we've got increased numbers, it means we're not supporting them to go home. So it's interesting that we're not seeing a big surge in numbers, or we weren't back then. But what I then said is, well, look, who are these children? And what we found was 70% were under 5, 50% were under 1. For those under 1, we then went, okay, let's look in detail at those children. Ring the social worker up. And if they say mental health, what kind of mental health difficulty is it? How long has it existed? Yeah. Are they currently getting treatment, or did they have a mental health problem, postnatal depression, 2 children ago, and it just keeps rolling forward in the file, so that we actually understand it? Because then it gives us evidence to go to partners and say 40% of children, yeah, coming into care in Leeds are born to a parent who had a previous child removed. 40%.
So it's the evidence to inform your preventative strategy.
Yeah.
Yeah. No, that is key, isn't it? No, thank you for answering those questions. And Nina, did you want to come in now and sort of provide some summing up comments? Just bearing in mind, I think as a committee, we'd like the actions to come back in the future, and there's certain actions which we've already identified. We're really keen to hear the recommendation 2 on the research in terms of what I think what Steve has literally just been talking about. If that research is able to be presented to us in whatever document it comes to you in, that would be really helpful as well. And I'll hand over to you now.
Oh, thank you, Chair. Just wanted to say a real big thank you to Steve for his report, for his time with the service, for his recommendations, and for coming, you know, since the completion of the report to inform Cabinet and now today to scrutiny. So it's been really, really welcome the report, welcome the recommendations. As a service, you know, we feel strongly that we've been improving and things have been improving, and we're very proud of the work that happens across the service, but we're also really ambitious, and we want to know and we want to do better. We always want to strive to be better and carry on our improvement journey and have that inquiring kind of mindsets that we've talked about. So earlier, Chair, you asked, was there any surprises? The themes that came out weren't surprises, but what was really helpful was there were suggestions of other areas to look, things to consider, which was really, really good. But it also gave us time to think and reflect as well, which very busy service, as you can imagine, you know, business as usual. And so forcing us to have that time to stop, reflect was great as well. And it just makes me smile, you know, and Steve said, oh, you're trying to do too much at once. We absolutely were. And it makes me chuckle now. So we've been really we've actually stopped doing some stuff now, some projects. We're like, actually, we don't think this isn't where we should be focusing our time at the moment and our resources at the moment. So we're going to stop those. We're going to focus on where we're going to have the most impact, etc., and prioritize and kind of scale things over a number of years rather than try to do everything at once. So that was really helpful. The action plan, absolutely, I would really welcome the opportunity to bring that back to yourselves in scrutiny, whether that's 6 months, we'll talk about the timescales, but I think that would be really important. I'd welcome that feedback as well. You know, you asked Steve where you think you as a scrutiny could kind of focus as well, and that kind of links, I think, to that research that you've asked, that information that's coming back. That's actually an area that myself and CLT have asked the service to look at, and a report is being prepared. So I think in the autumn, that's absolutely something we could bring forward to scrutiny as well to be looking at. There was a question about fostering.
Yeah.
And Sharon talked about the strengthening in the new corporate strategic equality plan, which is really, really positive, so much stronger now, both in terms of adults and children's actually in the corporate plan. I've met with colleagues corporately, and there's already a lot of benefits for our staff if they're fostering carers, but a lot of people don't know about it. So we're just about to do some comms on what the current benefits are from staff. We're also looking at what new benefits we could look to put in place for staff to encourage them to become in-house foster carers. And we're also looking about what we could do with local businesses in that area as well. So just to let you know, that's all happening. And then just to finish, thank you, Councillor Gareth. Sharon and I will absolutely take an action to pass on thanks to the whole service from yourselves as a scrutiny committee. So thank you so much for that. I really appreciate that. And you're right, the communications is really important now as well, because this report is, provides us all with this great level of assurance. There's so many positives within the report as well that I think we should sing about those a little bit, isn't it? We're always, perhaps we don't do that enough, but we absolutely should take the opportunity. So Sharon and I will take an action as well to look at that communications. And thank you so much for the suggestion and the support.
Thank you, Nina. Just quickly on the points which are relevant to other organisations, like particularly the Health Board. I know you mentioned about the I can't remember what it was called, Steve, but the assessment for a child when they've got an injury. But also something that absolutely baffled me is the fact that we don't have a contraceptive clinic in Powys. So things like that, where you think actually that is having a huge impact on how things impact children's services. If you decide that maybe that's something that we should be pushing for with other local authorities, how can that be fed back to us as councillors as to what's being done with those types of things? I think there's probably councillors who'd be interested in maybe helping campaign for things like that, or being involved in knowing whether that's even would it ever be feasible for us to have a contraceptive clinic in Powys? Why don't we have one? Could we have a mobile unit? I know that's sort of straying outside of our territory, but councillors don't just become interested in council related things.
Absolutely. Sharon and I are and will continue to have those conversations with the Health Board. It's a bit too early, I'm afraid, at the moment for me to feed back on that. I mean, Powys is such a large geographic county. We've got no district general hospitals, etc., and that is really challenging in these areas, particular that we're talking about. But perhaps we'll be feeding back as part of this action plan, Chair.
Yeah.
And how those conversations has gone, and perhaps it would be appropriate at that time then to discuss about any other future next steps and actions, and perhaps involvement from yourselves as a committee as well.
Thank you. That's great. Well, thank you again, Steve, and thank you, councillors, for your questions on that. I know we are over time, and so I just want to move on quickly, just to give the public an update on the fact that oh gosh, we've still got the response to scrutiny recommendations. I think, Nina, we in our pre-meeting, we have read those and noted those, and we didn't have any questions on those, and we're just grateful that they've been fed back on our recommendations from the day opportunities. I just also wanted to give the public an update on what was going to be an exempt item, which is our standing item of our consideration of the monthly performance reports. As a committee, we've decided that having that as a standing item is not actually working that well, i.e. we often run out of time like we have done today, but also there's so much documentation that we're looking at on a monthly basis, and a lot of our questions are operational. So we are going to set up 2 working groups to consider one for adults, one's for children's, to look at those on a quarterly basis offline in a non-public setting, where we can then see whether there's any themes that we want to consider or raise, or just question you about, or whether there's something we want to do a deep dive in. So that's where we're going to go with that. The work programme that is there. There's some slight amendments to the one coming in a couple of weeks, and myself, Nina, Kath, and Carrie-Anne and Gareth will pick that up separately. But I think we are of the view that the 14th of August meeting is going to be a little bit problematic given the timing of it, and it being bang smack in the holidays. And I think, other than the reflection, that is what we probably just need to do is a quick summary of our recommendations on each. And are there any recommendations which aren't clear that we've come up with today? So Kath, I'll just ask for you to have you got a note of what we've asked for?
On part one, the annual complaint report, I've got the constructive change regarding the wording, which I think was picked up in a number of items this afternoon. That it's not just the complaints, although there's a statutory responsibility to a complaints report, but maybe embed it within a broader complaints, compliments, comments sort of report. So that was one recommendation that came out. I'm whisking through the others. There weren't actually recommendations. There were for the capital and revenue outturn reports. There were actions for the service to come back. So that's more operational, for the service to come back, make sure the data was correct.
We had a request to do
Figures
laming visits.
and laming visits. Yeah, I've got laming visits regarding ADHD neurodiversity complaints.
I think generally as well, they're sort of team reviews as well.
Yeah, and from the latest, I think all the questions were probably answered on the latest report, and it was just for feedback to come back at later dates.
Yeah, so it's an action for it to come back to us, and for us to continue.
I've got a couple of others that I'll forward on to Kath and yourself, Chair, that I made a note of. It's more around, they're bitty, they aren't really, but you know, there's more on the first report around making sure we check the tables and make sure we understand how the calculations are being made.
Data.
Yeah.
To come back, yes.
Yeah.
But I'll forward my notes to Kath and yourself.
Thank you.
And carry on.
And then quickly, just a couple of minutes on any reflections from today. Anything you think we could do differently or observations?
Are we still live, Chair?
Do we?
Oh, okay. Do you want to do this in? Are we doing reflection or are we?
I'll do that. I'll do that in private. But I'm happy for any officers or Councillor Shan to leave, or you're welcome. You're more than welcome to stay to the private session to give any feedback you want to us. We would happily take anything on board as usual. But on that note, we can go offline. And thank you to the public who's listened in today.